hosting our online virtual open house for the graduate programs in population health management will be presented by Dr. Mark Bittle, Program Director, and myself, Angelica Santiago. I'm an admissions officer here. Thanks for joining us. Just to introduce myself, my name is Angelica Santiago. I'm an admissions officer here for the Applied Science online program. I've been working in higher education for about the past 5 years and with the Applied Science degrees for the past 3 years here at Johns Hopkins. Dr. Bittle, can you please introduce yourself to our audience?
Certainly. Thank you all for joining us. It's a pleasure to talk to you about our population health management program. As Angelica mentioned, my name is Mark Bittle. I'm the program director for the population health management program at the School of Public Health at Johns Hopkins. I'm also the program director for the Masters in Health Administration, which is a in-person health management program. Prior to joining the faculty about 2 years ago, I've been teaching with Hopkins part-time for about 15 years, but prior to that I was working in healthcare as a healthcare executive for about 30 years. So I come to the table with a lot of knowledge about our healthcare industry and also around this notion of population health management. Have been able to work with a lot of great colleagues and faculty to put together, I think, a program that is very, very meaningful in today's healthcare environment.
Thank you. So now what I'll be doing is I'll be going over our agenda, just giving you a little bit of idea about the presentation this evening. Dr. Bittle will start off with giving us more of an industry overview, really discussing why population health management is such a rapidly growing industry sector. He'll be able to take us through and go over program details. We do have both a full Master's of Applied Science in Population Health Management as well as a certificate in population health management. Dr. Bittle will be able to give us more insight into the curriculum itself and into online learning and what that looks like here at Johns Hopkins. A few details on key faculty members in the program, and then I will go forward with giving some details about our admissions requirements, financial aid and scholarship information, and then we'll leave some time at the end of the presentation for a quick Q&A session. So if you have questions that come up during the presentation, please feel free to type them into the chat box, and know that we'll be getting to those questions at the end and making sure to make some time for some of answering those questions. Dr. Bittle, thank you, and feel free to start.
Okay, and I just want to make sure, Angelica, you'll be advancing the slides, right?
Absolutely.
Okay. So then let's get started. Again, I think it's been very interesting to watch healthcare evolve over these 30 years that I've been in the business. And certainly, I don't think it comes as a surprise to many of us who have been in the industry for any length of time to know that we have a very fragmented or siloed system, as I like to say, and one that's fundamentally based on an acute care model. Certainly, as we've seen national healthcare expenditures increase year over year, and we've seen the results or the outcomes of the care that we deliver in this country falling well below most other developed countries across the world, there's an increasing demand for accountability in the management of those healthcare resources. And there are significant financial, political, and social wins, really, to change or improve those outcomes. So as we've seen payment reform efforts move us from a volume-based to more of a value-based reimbursement system, there have been significant incentives now for health systems to think about how they integrate, how they coordinate care, and how they collaborate, not only within their own health systems, which has been a significant focus over time, but certainly now thinking beyond the four walls of the traditional hospital and health system. And that's where I think this program, Population Health Management, really helps to provide our students with the ability to think beyond the four walls of the traditional health system in terms of how we improve health, and looks at, in particular, items like the health influencing factors associated with the determinants of health. So we're not thinking of just the episode of care anymore, but rather along a continuum of care that extends even into the determinants of health. So the population health management program really helps to bring focus to the health of populations by promoting what we refer to as the integration of public health practice and the management of healthcare delivery services. Next slide. So as I mentioned, as we started to contemplate this program about 2 years ago, we are now in our first year of the program, almost through the first year of the program. We recognized that this was an emerging and important strategy for healthcare providers and payers. What we wanted to create here at Johns Hopkins is an interdisciplinary program that's really designed to provide experienced professionals, such as all of you, with the tools and the skills necessary to develop a comprehensive approach to population health management, not only from a systems and strategy perspective, but also the ability to lead your organizations to develop population-focused models of value-driven accountable care. Because this program is coming from the School of Public Health, which Johns Hopkins is the #1 school of public health in the country, if not the world, we've been able to draw on significant public health background and experience so that we have a curriculum that's heavily influenced by items such as the determinants of health, as I mentioned, to help create a basis around public health, but then also merging that with our expertise around healthcare management into a program that is really not only interdisciplinary, but really focuses on sort of both sides, the public health and the care delivery side. Next slide. There we go. So we had originally, thank you. We had originally planned for this program to target clinicians and those already engaged in healthcare management roles within health systems, particularly as we've begun to see folks tapped, particularly physicians, being tapped to help lead transformative efforts within these hospitals and health systems to move towards more value-based, population-focused activities. We see that healthcare administration and management jobs are going to continue to grow as the healthcare sector has grown, but we think these new competencies and new skills, as the quote on the first slide indicated, are essential, I think, to being successful in developing a population health management strategy. So some of the titles that we've seen develop over the last several years around population health include some of the ones that you see on the screen: Vice President of Population Health, Director of Population Health or Healthcare Integration, Director of Community Health Operations, Population Health Initiatives Managers of various sorts. So again, what we're wanting to do is really target those individuals who have some working experience within our healthcare industry to provide them the skills to be able to transition to more a population health management focus. That being said, I also want to point out that this program is equally geared towards the folks that are in the communities, community-based organizations, federally qualified health centers, folks that have traditionally focused more on the public health side of things, perhaps, and maybe the care delivery in the community setting, and provide them some skills and competencies to help them work more effectively with the healthcare system. So I think it's really a program that's designed to bring both sides, again, public health and healthcare or the medical sectors together in a more meaningful way. Next slide. The program is designed in two pieces, if you will. One is to earn a certificate. You can get a graduate certificate in population health management by completing the 8 courses, which you'll see in a moment, or 25 credits, which is geared around 1 academic year, but because it's a part-time program, you would have 2 years to complete those 8 courses. So theoretically, we have 4 terms in a year. You could do 1 course per term, or you could do 2 courses per term and finish in 2 years or 1 year, respectively. You could apply for just the graduate certificate. You could apply for the master's degree. The master's degree would be completing the same coursework in the first year that you would for the certificate. but then to go on and create the second year 8 courses. Again, you would have up to 2 years to do that. So theoretically, to get the master's degree, you'd have up to 4 years part-time to do the program. If you apply to the master's degree and you complete your first year, you automatically get the certificate on your way to the master's. If you apply for just the certificate, you can, towards the end of that, decide, I would like to get my master's degree, and you could go ahead and apply for that as well. Because this is an applied program, and we take particular pride in the fact that this is applied, and what that means is that it's very skills-based, and it's geared towards working professionals. Part of that is obvious because it's a part-time program. The other part is probably obvious because it's 100% online. But I think this notion of being an applied program is so important to us. It's been great to hear from our current cohort of students, many of whom are physicians, who've reached out to me just to comment on the fact that they've been able to take what we're talking about or what they're learning about in these online sessions and apply them immediately at work. I had a physician call me who's in the program on a Sunday and said, I just want you to know I was asked to come to a meeting at our hospital. They want to learn about population health management. They want to understand, kind of what it means and how we can start to work together on this. And I was just so thrilled to be able to have a meaningful conversation with them, all based on what they had learned in just the first, 3 terms of our program. Academically or pedagogically, we understand that everybody in this program are adult learners, and so we've really tried to gear this towards adult learners. We as adults, myself included, all learn, by doing things as groups. So we do have group activities, even though it's an online virtual environment. We do peer-to-peer assessments, so the individuals, the students work together, and so there's a lot of peer learning and peer sharing that goes on. And as I said, it's very skills-oriented. There are projects, cases, hands-on learning opportunities, so that it's just not theoretical, but really we do our best to make it as applied as we can. So the goal is to really focus on developing an understanding of how to lead population health management systems so that we can work collectively, collaboratively across settings and across sectors to improve health in our populations. Next slide. So this is a visual of our first year curriculum. At the top, you'll see the 0 Introduction to Online Learning. Right below that, you'll see Academic and Research Ethics. Those are 2 sort of introductory models that everybody's required to take before they begin online learning. The rest of it then are the courses. So for example, in term 1, you have 2 courses there, Essentials of Population Health Management, a 3-credit course, and Principles and Applications of Applied Payment Models in Population Health Management, also 3 credits. I teach that Principles and Applications course. And then you can see the other 2 courses in the 2nd term, 3rd term, and 4th term. Again, you can take one at a time, and it would take you 2 years to complete that curriculum, or you can do 2 a term, and you can complete it in 1 year. If you complete it, or when you complete it, you would earn the certificate. Next slide. This slide then layers on year 2. Again, you can see there are 8 courses, 2 per term. To complete both the certificate or the year 1 and year 2, you have up to 4 years, as I've mentioned. Again, you can see the courses there, high reliability healthcare, for example. We have organizing for public health, a systems approach, behavioral economics and risk, looking at value-based payment models and incentives. We have a course on the built environment. Again, the influences and challenges to improving population health as we consider, one of the key social determinants of health is our environment. You'll notice at the end in the term 4 of year 2, there's an integrative activity. The integrative activity is an opportunity for students who are earning a graduate degree at Hopkins to do just that, integrate everything that they've learned into a culminating project, if you will. The culminating project is a case that the students are given, and then they are evaluated based on their ability to integrate what they've learned over the 2 years into addressing the issues that are presented in the case, as well as drawing in external resources as appropriate. So that integrated activity is the final culminating event prior to graduating with a master's degree in a Master's of Applied Science in Population Health Management. Next slide. Hopkins has a great deal of experience in online learning. As you can see, over 20 years of experience. Our Master's in Public Health is an online course. It's been online for many, many years, long before many organizations, academic organizations had online courses. We've done a lot with free courses as well through our Coursera products. But we work with a Center for Teaching and Learning, staffed with educators themselves that work closely with the faculty to develop not so much their content, but to develop the means by which that content is shared with our students, so that it's an engaging, because it's an online, there are recorded sessions. So we work very hard to make those engaging. We work hard to embed opportunities for the students to engage in sort of feedback and dialogue via discussion boards, and as well as practical online learning experiences such as cases, etc. So we work very hard, again, to make these lectures enjoyable and engaging for the students, as well as, again, because they're online, you have the flexibility of working around your schedule. As I mentioned, we are on a term basis, so we have 4 terms in an academic year. Each term is 8 weeks. Essentially, the way the courses work is they open on a Monday and they close on a Sunday. So within that week, you have the week to basically work on all the materials for that module. The 3 terms that we've gone through so far with our initial cohort in this population health management program has been extraordinarily smooth from my perspective, from a technical basis, in terms of the quality of the programming in our lectures. But there is, if necessary, a 24/7 help desk, so you should never be worried about something freezing or crashing or what have you in the middle of your sessions. So again, I think we are well positioned to be able to provide you with a great learning opportunity. Next slide. While I think we have a wonderful and an engaging curriculum, it wouldn't be a program without the faculty. And I think there are 2 things about our program faculty that I want to mention, and you can see their names here. One is the fact that this is truly an interdisciplinary program. So next to each of the names that you see, I have a superscript, and you can see at the bottom the legend. So we have a number of people who are in the Health Policy and Management Department. That's my home department. But we also have folks that have contributed content from Health, Behavior, and Society, Epidemiology, International Health, Biostatistics, and Environmental Health and Engineering. We also have a number of faculty that have joint appointments. So teaching in the program, we have not only the School of Public Health represented, but we also have the School of Medicine. And I should have also listed the Cary Business School, because I have a joint appointment there as well. So again, I think it's been very helpful to us to bring together a curriculum that really does pull from a significant background in public health, and then merging that with the health policy and management concepts around healthcare management and delivery. The other thing that I would say about the faculty is that it's a combination of full-time and practitioner faculty. So these are not all academic faculty who are just doing research, but many of them, like myself, have been in the business for a long time, or are currently in the business and are doing this as a part-time or practitioner faculty. The course, for example, on quality back in the first year, second term, Dr. Baker teaches that, and he's the director of ambulatory quality and population health for a large community academic health system here in Baltimore. One of the other courses on care management is actually led and taught by a physician-nurse team. The physician is a geriatrician practicing every day, but has a considerable amount of interest and experience around care coordination, care management, has partnered with the vice president of clinical operations for a large managed care organization who is responsible for doing care management and is a certified care manager. So those two have come together to develop the course on care management and advanced models of care management in a population health management setting. So again, we've tried to really bring in the academic as well as the practical to make this an applied degree. And at this point, I will turn it back over to Angelica.
Thank you, Mark. At this point, I'd like to get a chance to just give everybody a little bit more insight after you've learned all those details about the program. Just learn a little bit about the admissions requirement and the admissions process here. So our applications for both of our programs go through online centralized application services. You'll see here it says SOFIS and SOFIS Express. So for the master's degree, students would apply through SOFIS, and for the certificate, students would apply through SOFIS Express. For both programs, we do require students to have a completed bachelor's degree from an accredited college or university and be able to demonstrate a minimum of 3 years of health-related work experience. So you'll need to provide, as part of the application process, your current resume or CV that does demonstrate some of that in your background. It is required for the master's degree to obtain 3 letters of recommendation through the online portal, where for the certificate, you'll be required to receive 1 letter of recommendation. In each of the applications, students will have to be able to write a statement of purpose or a goal statement that will clearly connect their goals, their interests to the objectives of the program, and just demonstrate why this program is the right fit and the right next step for you. For any of our students that are attending this evening who have education that has been received internationally, we do require a course-by-course credential evaluation via the World Education Services, as well as a proficiency exam in English through either the TOEFL or IELTS. For the admissions process, our students are reviewed on an ongoing basis, so we do encourage students to apply as soon as possible. The ultimate deadline for applications will be Sunday, July 1st of this year. And students are enrolled 1 time per year. So while there is flexibility, as Dr. Bittle referenced, while you're in the program to decide at what pace is appropriate to your schedule to take 1 class at a time, to take 2 classes, you would still have to start within our fall cohort. Our academic year this year starts on September 4th, and that will be the start of classes for the 2018-2019 school year. To go over a little bit about the tuition information as well as the scholarships that are available through this program. The 2017-2018 tuition was $1,091 per credit. Scholarships are available. It is the OPAL scholarship, which is specific to our online applied science learning program. The scholarship takes off about $419 per credit, which leaves students responsible for about $672 per credit. That is the tuition rates for the 2017-2018 school year, and tuition rates and scholarships are reassessed each spring for the following academic year. So please stay tuned to our website. We will be providing some updated information if there's any changes here within the next few months. The admissions application is all that you have to put forward to be reviewed for the scholarship. So there is no additional applications for the scholarship, and if you are accepted into the program, that scholarship will automatically be awarded. Beyond any scholarships, students can take note of the information for our financial aid office and financial aid office services here. It's the phone number and the email specifically for financial aid if you have questions specifically regarding assistance with federal or private loans. Now we'd like to open some time up for some Q&A. I'll be able to answer questions that are specific to admissions, and then we'll refer over to Dr. Bittle for any questions that are specific to the content of the curriculum or the program itself. All right, so our first question, it looks like, will be towards a little bit about the healthcare experience or health-related experience. So I think this would be great for you, Dr. Bittle, to kind of expand upon. I think you touched on it a little bit talking when you were speaking earlier, but maybe expanding upon some of our current cohort. What is expected from students when we say 3 years of health-related experience?
Sure. So I think, so when I look at our current cohort of students, we have a number of them that are physicians. We have several that are in executive positions, some of which I had mentioned earlier on screen, related to population health. We have some social work, care management individuals in the program. We also have some industry individuals who are in healthcare, in other aspects of the healthcare industry, whether it might be in the pharmaceutical side of the business or in the health insurance side of the business. So the 3 years is really is something that we thought was important so that we didn't have to spend a lot of time explaining, for example, what health insurance is, as opposed to really being able to start talking from the beginning about, for example, we do one of the first courses you'll take in the program is Essentials of Population Health Management. So it presumes a certain level of understanding of what's happening in the industry today, why population health is being discussed in the first place. But we also recognize that not everybody's going to have every piece. So again, not to be redundant for some folks, we do make it so that there's enough of the foundational or fundamental information provided so that we build on it as we go forward. So having some semblance of experience in the healthcare industry is really important. That could, again, be from a federally qualified health center. It could be in a hospital or health system. But I think one of the most appropriate target audiences for this is really the physicians and the clinicians that are being tapped to help lead transformation of their health systems around population health. But again, that doesn't discount any of the other important positions in hospitals and health systems and those in the community that are interacting with and helping to develop these new models of care delivery.
Perfect, thank you. I think I can probably take on the next question. We have someone asking if there is opportunity to finish the coursework early, as well as if there's opportunity to expand the classes and how many classes are taken per term. So the classes are delivered in a certain sequence, so unfortunately there is not an opportunity to finish the certificate earlier than the 1 year that is set, or finish the master's degree in the 2 years that are set, but there is flexibility and opportunity to expand if necessary. So the certificates have a maximum of 3 years for a completion time, and the master's degrees have a maximum of 4 years for completion time. If you're looking at taking a certificate in 1 year, you would take 2 classes in an 8-week session. So there are 4 different 8-week sessions. So you would take 2 classes every 8 weeks to finish in 1 year, all 8 classes. And then for the master's degree, you would take 2 classes every 8 weeks, have the summer in between off, and then the second year take 2 classes every 8 weeks. There is a follow-up question, which maybe Dr. Bittle, you can help me out with as far as the time commitment. An estimated time commitment. I think we've gotten feedback from some students that it's anywhere, if you're taking 2 classes about 18 to 20 hours a week worth of schoolwork in an asynchronous format, of course, so you don't have required login time. Would you give any follow-up sort of insight that you have on that?
Certainly, that's a great question. So essentially, the way you think about it, the way we think about it in the school is for every 3 hours, for a 3-credit course, effectively you're talking about 3 hours in a classroom during a week. So that could be 2 1.5-hour classroom sessions, and then double that outside of the class. In other words, upwards of 9 hours a week of work per class. And so most of our courses are 3 credits. There's I think 1 or 2 of them that are 4 credit, biostats and epi. So you can think about it as about 9 hours worth of work a week. Obviously, there's no in-classroom time associated with this, but effectively those 9 hours is what you could expect to put into it, and that per class. So if you're taking 2 classes, yes, about 18 hours a week. As Angelica said, of course, there's, as I mentioned earlier as well, the class module starts the week of, say Monday morning, and then closes at 11:59 p.m. on a Sunday. So you have the entire week to listen to the recorded lectures, to do the readings. If there is any sort of assessment that's due that week, maybe a quiz, then you're able to do it any time during that 7-day period. Typically, most courses, I would say, don't have quizzes, but that's not to say that all do or do not. Some do. Papers, case assignments, maybe some group work if you're working on a group paper. Those are things, again, that the students can coordinate amongst themselves in terms of how they get together, how they share documents to work together. So it is a lot more flexible in terms of your work time, because again, there's no hard and fast times that you have to be on the computer, if you will. Most of the classes, if not all of them, do have at least 2 synchronous sessions. So what that means is similar to what we're doing tonight. We would get on line together, and we would talk. We'd be talking with the faculty member who's teaching the course. They may have a guest speaker joining to provide you some, contemporary insight on a particular topic, or they may be, online to help answer questions, particularly related to biostatistics or epidemiology courses where you might be working on a problem set. So you're not isolated from the faculty member by any stretch, and I think that's important because these are not sort of the way I envisioned an online class where you just listen to a bunch of recordings and maybe take a test at the end and you're finished. And, as the question sort of implied, if I can do it quicker, I can finish it quicker. It doesn't work that way. These are structured course offerings that are broken into typically 8 one-week modules, so that by the end of the 8-week term, you have finished the course. You can read ahead, you can watch ahead in the videos, but typically assignments are dispersed throughout that 8-week term so that students are able to manage the workload effectively.
Perfect. Thank you for providing more details on that for a better view of what it looks like to be involved in the online class. I had a great question that came up if there was any travel required, which I think I can go ahead and let students know. It is designed to be a fully online program. There is no travel required for this program, no residency requirements. I would say that if you do live in the Baltimore area, or if you're traveling through the Baltimore area and ever wanted to schedule some time to speak with faculty or anyone on campus, you're more than welcome to get in touch with us or get in touch with your faculty to be able to do so. We've definitely helped arrange that in the past, which is always a great opportunity if you're in the area.
Yeah, I have to say that was probably one of my more exciting moments. Was over the Thanksgiving holiday. A student was coming into town to visit family for Thanksgiving, and had never been to Hopkins. And I was able to. She was actually taking one of my courses at the time, and so I was able to meet with her, show her around the school. We actually ran into the dean of our School of Public Health. So it's a great opportunity. We definitely welcome that. And again, I just want to reiterate the connection that you have to the faculty. Just like we're talking now, you would have access to each of your faculty members through, while you're taking the courses, and even after, I get, obviously I'm the program director, but I taught a course in the first term, I teach a course second term of the first year, and I also teach a course in the second year, third term, I believe. And so, I am always open to having students contact me and ask me advice about a job consideration, or upcoming courses, or a question about a course they're taking. So again, this is not your typical sort of, if you do have sort of a preconceived notion of what an online course is, this isn't that. I mean, it really is a very personal approach to online learning.
No, thank you for that insight into the support that's offered, and just giving us more details on your experience with students from this past year. I had a great question that came up, Dr. Bittle, that I think would be great for you to answer. It's a little bit more specific, but I think it's something that has come up before. We have a student that's interested, if the program will go forward and teach you skills as far as value-based pricing. Could you share a few examples of skill set or competencies that are taught within that?
So maybe I'm not understanding what value-based pricing is. Perhaps Angela, if you could go back to Angelica, can you go back to the slide with the 2 terms on it? I'm sorry, the
Absolutely.
2 years of courses. Yeah,
and I think they are looking at the advanced payment models is what they are referring to.
Yeah, okay, so if you can just go back to that slide. Great.
There you go.
So we have a number of, so I think what's interesting, if you kind of take a moment or two to look through what each of these courses are offering. So we start out with an essentials of population health management. It's a good place to start, right? And we kind of talk about in that course actually a little bit about what you're going to be learning in every other course that follows. So we sort of talk about, the essential elements to developing a population health management strategy. And then those elements are largely explored in much more detail in the subsequent courses that you take in the program. So in year 1, term 1, there's the essentials, but then there's also principles and applications of advanced payment models and population health management. I teach that course. And in that course, we talk about, the various value-based payment methodologies that are out there today, the influence that those are having on delivery system reform and behaviors. But then we also look sort of beyond that to say, a lot of these models are just scratching at the surface of population health management. And I'll use the accountable care organization payment model as an example. So clearly, in an ACO delivery system, you're trying to look at ways to better coordinate care, integrate care. A lot of that is within your health system because that's who's accountable. But what people quickly realize in these ACOs is that a lot of the health influencing factors in their cohort of patients are things that are outside their scope of influence, their sphere of influence. So they really need to start thinking about how do I work with, as a health system, how do I work with these community-based organizations? How do I work with public health departments? How do I work with, other providers in the community around these factors like social determinants of health? And so we talk about the various payment models and how they need to evolve to be able to start really thinking about incorporating these other components that are outside the 4 walls. You get into term 2, the collective impact developing and leading community partnerships is a course that's designed to sort of help answer that question. How do we work outside the 4 walls of our hospital? How do we create, better collaborative relationships? How do we manage differently in those relationships? Again, sort of from the health system perspective. And how do we really truly develop programs that will have a collective impact? The notion there being that none of us individually are going to be able to move the needle. Collectively, we have to work together to do that. And then, so you can see, we talk about sort of accountable care from a quality and effectiveness perspective. How do you measure quality and effectiveness in a population health model? We look at consumer and health informatics. So again, an IT-oriented class around data and data management, and this notion of data analytics, predictive analytics. Of course, there's epi and biostatistics. You can't have that. You can't have a program in a school of public health without having those essential courses. Fourth term, in the first year, we talk about managing health across the care continuum. So there again, we're looking at these contemporary models of disease prevention and care management. It's one thing to manage care within a health system or even within an integrated, quote unquote, healthcare system. But now how do you start to manage care when it goes beyond the four walls and you start to factor in, a lot of these health influencing factors that are outside, again, the scope of a health system. So again, each one of these courses sort of builds on the notion of what's an essential components of a population health management strategy, and then we've sort of developed courses around each. So back to the original sort of question, obviously we talk about right up front, I think, the importance of how we pay for healthcare, because we can look back historically and see that how we have paid for healthcare has influenced how we deliver healthcare. So if we want to change the way we're delivering healthcare and we want to change the outcomes that we're getting, then we should be thinking about different ways to pay for things. And of course that's happening, but it needs to go further if we start thinking about populations. We do have a course in behavioral economics and risk. So as you know, probably know that many of our value-based payment models are built on the assumption that we're going to be sharing risk amongst our provider groups. And those risks are designed to create certain incentives around how those providers behave. But now if you start to, again, look at that beyond the healthcare system, what are we doing in the way of creating, using the knowledge that we've gained through behavioral economics and risk sharing to build a model, a payment model, value-based payment model that's going to, again, sort of incorporate the community-based organizations and the federal qualified health centers or other folks in the community, local public health departments that are essential elements to this sort of collective impact that we're trying to have on population health. So it looks at, again, how do we sort of structure our payment models to leverage what we know about behavioral economics and risk to develop appropriate incentives. And then, as I say, we talk about value-based concepts of socially responsible leadership. I think managing health systems by virtue of this idea of collaboration outside of the four walls requires a different view of leadership, what I refer to socially responsible leadership. I teach that course as well. And then we look at the built environment as well in terms of how that influences health and how we can impact that. So if anybody knows about Baltimore and West Baltimore, it's probably one of the poorest neighborhoods in the city. It's also one in which the life expectancy is a good 20 years less than the average in the state. And the health system in that area has worked significantly to build appropriate housing for folks in that neighborhood, in those neighborhoods, to the extent now that they actually own and operate more apartment units than they do hospital beds. So again, they've really put a lot of their effort in terms of building their health system in building it sort of from the outside as opposed to building up their acute care system. So that's a quick overview. I know it's a much longer answer to the question I think that was asked, but I thought it was a good opportunity to kind of walk through each of the courses and give you some sense of how they kind of fit together. But there's at least 3 of them in there that have that focus on sort of the funding and payment model and how we align incentives and how we can use those to change the outcomes that we're seeing.
No, thank you. I think that was a good opportunity to be a little bit more thorough with the coursework and just give them a better idea of what to expect and opportunities with building upon skills throughout the program. I did have a quick question from someone that they unfortunately had some technical issues with seeing the presentation. There will be a recording made. So if for any reason you were not able to join us right on time when we started, not to worry, there will be a recording made and the recording will be made available soon. And of course, if you reach out to me directly, my phone number and email are on this current slide. But if you reach out to me directly, then we can schedule some time to speak a little bit more one-on-one. And I can also personally send you the recording later once we have it available. Dr. Bittle, we do have just a few more questions. We have a few more minutes. Would you mind answering a few more questions for us?
I would not mind at all.
Perfect. We had a student that was curious if there, with this being a graduate program, if there is any expectation on quantitative background coming into the program. There is no GRE requirements for application. I can let students know that, but maybe you can give them insight if there's any expectation on their quantitative background, either coursework or professional experience.
A great question, and we look in the application at exactly those two things. So while there is no GRE requirement for this program, we do look at your undergraduate work, even though, perhaps in some cases it's perhaps years ago, but we do look at it, and we do look specifically at, the type of courses that you took, to the, just to give you an example, if we saw you majored in music as the example, and my daughter-in-law majored in music, so I can say that. But anyway, we would look at that and just look to see what kinds of courses that you had and how you did in the quantitative types. And if, for example, you did major in music, but you were working as a data analyst, in a healthcare system, we would certainly also look at the kinds of work that you're doing and what you would be exposed to in the way of quantitative work in that role. The real quantitative courses, of course, are epidemiology and biostatistics. There's only one of each. They're designed for the non-biostatistician or non-epidemiologist, so they aren't hardcore, you're going to get your master's or doctorate in biostatistics. But they are rigorous, and they do require a certain level of understanding. So I think if you've taken most undergrad courses or programs have opportunities to take a biostats course or a statistics course, even if it's business statistics, that's fine. But if you certainly have any concern about it, there are other resources that are available for those courses, especially to help through that. And a lot of it is, again, driven through the problem sets that you work on. So it's very much a hands-on skills building kind of program.
Perfect, thank you. This is a pretty simple one that I think I can go ahead and take care of answering. Are students allowed to participate in graduation ceremonies at Johns Hopkins? The answer is yes, and obviously it's very encouraged. It's not mandated, as we understand students do choose the online programs typically to be able to advance in their careers without having to move for a program. So it's not mandated, but it's definitely strongly encouraged, and we get very excited when students are able to come and attend graduations. Of course, we have student service coordinators that work with our students throughout the time that they're in a program. So there's always someone to talk to once it's getting closer to time to graduate, so you get more details on the how-to process for everything. So there's a lot of points of communication, not just with your faculty, but also with your student service coordinators who are with you throughout the program, and they're a great source of information.
Yeah, I would just add one thing to that, if I may. For those who might be considering the certificate, those certificates are mailed directly. They're not given out at commencement. But certainly the master's degree, you are not only encouraged, but I would love to see everyone who pursues the master's degree come to commencement.
Okay, and thank you for adding the clarification for the certificate. As far as student backgrounds are concerned, whether it's current cohort or just the type of candidates that you are looking for, we have a couple students that are asking if they work in more healthcare insurance or healthcare data analysts, not the traditional in the healthcare setting, if this program would still be appropriate if their long-term goals were in line with the program materials.
And I think that's really the key is the alignment of goals. So no, you don't have to specifically be working in a hospital or health system to apply for this program. As I say, I think we're really looking at folks that are involved in the industry and that are looking to advance this notion of population health across the various sectors that need to come together to make that happen. So whether you're in, working for an insurance company, CareFirst Blue Cross Blue Shield, for example, or a federally qualified healthcare center, as I mentioned before, a health system. You could be a social worker that's working, in a public health organization or community-based organization. I think it's really, the question is really more back at you, meaning look in a mirror and ask yourself the question, what am I looking to get out of this program that's going to help me, achieve the goals that I have for myself? And having an honest conversation to say, yes, these are the skills and competencies that are going to help me either move in a different direction towards a career goal that I see myself in, or to enhance what I currently have in the way of skills and competencies to be able to move up to the next level. So I think what we're seeing already, just in the folks that have applied, and there's probably some selection bias in all of this, but these are folks that are now being tapped on the shoulder to be, again, brought to the table around population health management discussions that are being, offered or talked to about promotions in their organizations, because now they're, they can talk this language that's currently evolving. So it's not a guarantee for promotion, don't get me wrong, but I do think again, it's important to sort of think about what it is you want to get out of it, how this program aligns with your goals, and be able to articulate that in your statement of purpose, so that it's obvious to us and the folks that are on the admission committee, myself being one of them, can see that yes, absolutely, this person is going to be able to take what we help provide them through our courses and apply it in a meaningful way.
Well, I think that is all the time we have for this evening. Dr. Bittle, I want to thank you for being so thorough throughout the presentation, for offering such great insight into the program, the certificate, as well as the full master's degree. If the information that you heard this evening resonated with your personal goals, with your career goals, and you feel like the next step for you is to start an application, or even if you're not ready for the application, but you want to contact and speak with an admissions officer directly to speak a little bit more in detail about maybe questions that are more particular to your background, if we weren't able to answer them tonight, please take note of the phone number and the email on this slide. You can reach out. That will go directly to me, and I will be in personal contact with you to further discuss the program. This is all the time we have for this evening, but thank you so much for joining us. Dr. Bittle, thank you so much again.
Angelica, my pleasure, and thank you for helping to guide us through it.
Absolutely. Everyone have a great night, and we'll look forward to talking with you in the future.
Good night, everyone.